Hello, hello. Let's talk to men. What men can do when you are a woman or you see a woman lose a pregnancy. Actually, this is not time to quarrel to them, to fight them, to talk negative towards them or against them. This is the right time to support them. It is not easy to carry a pregnancy. For those who have wives or have seen their wife carrying a baby, it's not that easy. So don't stigmatize them, don't judge them, stand by their side, observe their movement, observe their behaviors. If they have negative behavior towards life, they have risky behaviors like they are not eating, they are drinking, they are not sleeping, they are not working, and they have they are personalized that I am not a woman enough, I can't give birth. The people are this and this, this messed, and they are touching it is a witchcraft, it's this and this. No, these are good. It's the right time to listen to them and then look a positive way. If possible for men, take them through that journey. Look for someone who can talk to them, someone who has an experience. You can look for also a support group. So for counselors, you can look for counselors, psychologists, healthcare workers. Nurses can do this very well. They are more experienced. They have seen mothers losing their baby when delivering. They have supported a couple of them, especially women nurses. They can really support them. They can disclose also because we all experience, even as we are health workers, we experience the same. And then also look for support group. Some support group who can support mothers who have lost their pregnancy. It's good to support them because we don't have another way to do in this world other than supporting people. The support group people disclose how they have handled their loss, how they have supported their partners. And then they will say how many babies they have lost before and get one. I have seen women who have lost 5 pregnancy, 7 pregnancy. And through support, they are able to get to at least a live baby. They're able to carry a baby for 9 months. Their condition like diabetes, hypertension, infection, especially sexually transmitted infection can cause that. Pelvic inflammatory also in disease or infection can also cause that. Then people with the fibroids can also cause ambiguous or on and off meaning the miscarriage. And also there are people with incompetency, cervix, who are not in position to have to carry a baby to term, which need medication. Others may have ectopic pregnancy. So men is good. We support these people. Let know. Don't also lock yourself in the house and start drinking and say, "Oh, my wife cannot give me baby, or I am going to look for another." No, before you do that, it's good you go to hospital, and also you feel part of the process. So grieve as you culturally you grieve, as you believe. If you go to church or any religion, you grieve. Sometimes we have to process. Let's have an anniversary even for this lost pregnancy, if that what can help you to heal. Then acknowledge that the loss was not intentionally or was not directly caused by the woman, because there are some of us men we may judge and say, "Oh, this is a woman, she did not want to carry my pregnancy, that's why she did this." I believe majority of them, if they are hand well, it's high time you are going to learn that some pregnancy are not like people want to abort. And then it's good also for men to be part of the medical process. When you realize your woman is carrying a pregnancy or she is pregnant, start going to hospital with her, start knowing what is happening, ask the doctors or the workers question, they will guide you, they will be your support system. Know the medication they are supposed to take, know the work they can do, what they are not supposed to do, so that we increase chances of supporting the baby. Sometimes you see women, they are carrying their pregnancy, nobody is supporting them. Men, they are away. We go now to watch football, Arsenal, Chelsea, Liverpool, Man City, and they are celebrating. We go to drinking. We go to our friends, and we are waiting when the baby will come. No, that's not the right time to do and have attachment with your baby. Maybe other day we will see how men can increase their attachment with their babies, with their pregnant wives. So, because by the end of the day, if you start having an attachment, you see the way you have an attachment with cars, attachment with house or a plot, attachment with football, and other things that have interest. It's now the same thing that you can increase when your attachment with the baby. So even when the baby is born already, you feel like, I am a father. I need to provide one, two, three. And actually, if you do this, the issue of DNA, why you say, oh, the woman is carrying the baby who is not mine, they are not going to cheat you. But when we run away with the first pregnancy, or we run away, they can do things because now you can't even know, you can't even assess yourself, and then you start coming to look for DNA. Actually, men seek DNA more than women. Now, what am I saying anyway? Yeah, men. There is 100% men, they are the one who wait for a DNA to confirm. But for women, they don't need a DNA. So for us men, we have to be close. If you have a woman, be close so that nobody will jump or nobody will inaitangwaje ile ya kipetero. Hakuna mtu atakuruka so that you don't be supporting babies who are not yours. So in this process, this video has brought that idea as we help our women to grieve loss of miscarriage. Also as men, we are also grieving. Look for men who are supporting you, not men who are telling you, be strong, you are man enough. No, show your emotion, cry, express yourself. But at the end of the day, you are going to overcome it. It's not that easy. And then through that, you realize all women goes through. You realize the importance of family planning. You realize the importance of good nutrition. You realize the importance of going to hospital. You realize the importance of having a health mind, people who are mentally okay. Because even stress itself, there's a way you stress your woman, can really miscarry. I have a story of people who have overworked because of stress at work, burnout, stress, depression, and the babies just they have not they had a miscarriage, even a 8 months baby or a pregnancy. So let's be supportive men. Let's be there. And also, let's learn one or two things. We are living in a modern. Let's have insurance. Let's have people can take our wives to hospital. Maybe you have called someone with a tax or a Uber or a car. If this happen, you tell your woman or your lady, you can call this number so that they can support them when you are not there. Because sometimes you may see ourselves, we are so far when things are happening. When women are going to deliver, you are not even here, you are outside the country, you are assigned a job somewhere. Let's talk of people like police officer, security. They are maybe far away offering security, and they have their women who are delivering. So they need to organize that, put things into system. So thank you for watching this. If you find it is useful, share with others so that we can support each other. So this is one of our live video. Thank you for watching. Cardano Depth Connection.